Okay, here we are. You can see here now, here's the defect. You can see where I microfractured it coming all the way around. I'm going ahead and just cleaning up some of the fibrofatty tissue around that and actually let that bleed a little bit too. That'll help heal this defect. And you can see here now, if we turn our flow down a little bit, turn the pressure off. And then if I use my shaving tool, what you'll see here, that these holes will begin to bleed. And you can see right there, that's exactly what we want to see from this defect, is we see that it's kind of forming this blanket all the way over the defect right in there. And that's exactly what we want to allow this to fill in with the fibrocartilage that we've talked about. So here's the defect. You can see here now the holes are nicely bleeding. That looks great. Turn the flow back on. And you see as we turn our fluid back on for visualization, we can get that all cleared. So we've got an excellent treatment here. We've taken out the loose fragment. I've microfractured the defect. And the rest of your knee actually looked quite good. So I didn't see a whole lot of arthritis wear change. There's a little tiny bit of wear underneath the kneecap area, and I'll just smooth and clean that up here right now. And I think by taking out that loose body and cleaning up the joint, this is really going to give you some nice relief here. So I want you to keep your weight off of it for a couple of weeks. We're just going to unload the joint a little bit. It is an extra articular, non-weight bearing area, except a little bit on that patellofemoral joint. And so I think that by letting this be protected for a few weeks, you'll be in good shape here, Gary. And we should be able to get this to fill in. So you can see there, that looks good. There's your patellofemoral articulation. There's where that little superficial area of wear was right there in the central aspect of the trochlea. And then as I move out here more laterally, that's where our main defect was on that lateral femoral condyle. Right there. And again, with your leg out straight, so this is an extension, we can actually see the defect here pretty well. And what I want to do here is just get one last look at the defect. And then we will be in good shape here. Get some outflow on our cannula. Clear a little bit. And now we'll bring our blue cannula down and in, just like that. Here's our probe. And so again, here's the extent of that. I like that little bit of oozing. That's going to help this to heal. So we want to let it bleed just a little bit there. Braided the synovium a little bit. And then what I want to do is I want to see where this is from an articular point of view. Get a little more flow. And then I'm going to put my pressure back up. I had lowered the pressure so that we could see the oozing. Now we've seen enough of the oozing. Now we're going to slowly start to extend the foot here just a little bit. And so you can see now there's your leg up on the table. And we can see here that this lesion is pretty much extra articular in extension. So it really required a significant hyperextension injury for this to occur. And so I think that we can actually let you pretty much weight bear, because I don't think that's going to really have an impact. So we're going to keep you on crutches for a couple of weeks. There's your defect right in there. I've gone ahead and done our microfracture. We've taken out the loose body, and I think you're going to be real happy with this. Go ahead and use lots of ice like we talked about, and I'll speak with you in recovery here in just a few minutes.